When all patients are admitted to hospital, it is important that they discuss with their physician their goals of care or wishes should their health deteriorate. This video is designed to inform you about CPR, an intervention which would be required should you have a cardiac arrest.
Hi, Mr. Smith, how are you doing today? Mr. Smith? Mr. Smith, can you hear me? Mr. Smith? I don't have a pulse and he's not breathing. We'll call a code. Code blue! Code blue!
Cardiac arrest occurs when the heart fails to pump blood adequately to the rest of the body. People are unconscious during a cardiac arrest and have no pulse. There are various causes of cardiac arrest. During an arrest, the body's organs do not receive enough oxygen, causing organ damage and even failure.
I went to check on him and he wasn't responding. He didn't have a pulse.
Organs of vital importance, including the brain, kidneys, and liver, may suffer mild to severe irreversible damage.
CPR, or cardiopulmonary resuscitation, is a life-preserving measure used during cardiac arrest. The purpose of CPR is to attempt to circulate blood by externally compressing the heart, to provide a small amount of oxygen to the body. The act of CPR requires forceful, deep, and rapid compressions. This may lead to broken ribs and damage to internal organs. External compressions are not as effective as your own heart in circulating blood. Also, compressions do not fix the reason for the cardiac arrest, but they do help to keep blood flowing to vital organs while the healthcare team attempts to determine and treat the cause.
I'm going to place the pads, first one on the front.
Let me know when you're ready.
All right, hands off. Start CPR. All right, ready for the pad on the back. Let's move and put the pad on the back.
Rolling.
Turn in place, start CPR.
A mask will be applied to the face during CPR to allow artificial breaths to be administered for the patient. Let's do a pulse check and switch. No pulse. We have rhythm.
Non-shockable rhythm.
Continue CPR.
If necessary, a breathing tube will be inserted into the patient's trachea or windpipe, and the patient will be placed on a ventilator or breathing machine.
Defibrillation, commonly known as shocking, is also a part of CPR, performed when certain abnormal heart rhythms are identified.
Pulse check.
We got nothing.
Shockable rhythm.
Continue CPR.
Okay.
Charging.
Electrical conducting pads are placed on the chest and back and connected to a defibrillator capable of administering a shock.
Delivering charge.
These abnormal rhythms are the cause of cardiac arrest in about 20% of in-hospital cardiac arrests. CPR and medications would still be given when defibrillation is not indicated.
When a patient's pulse is successfully restored, they will require transfer to an intensive care unit. Most will require life support. Prognosis will not immediately be known for the patient's condition, and it may take days to assess the extent of organ damage or likelihood of full recovery, especially from a neurological standpoint. Not all patients successfully regain a pulse.
Success of treating in-hospital cardiac arrest is limited. Overall, 1 in 4 people survive and are well enough to leave the hospital. Of the patients who survive to discharge, 20% have severe neurological problems. These include mental and physical disabilities requiring help for day-to-day activities, and may include being vegetative and non-interactive. 80% will have normal function or moderate neurological difficulties, including thinking and memory problems or physical disability, but are still able to care for themselves independently. Overall, 10% of cardiac arrest in hospital result in the patient being discharged with normal brain function.
There are many variables that affect the outcome of CPR. Older age, other serious medical problems, and longer time without a pulse will limit success. Declining CPR does not mean that the level of care in hospital will change or decrease in any way for you. Declining CPR would simply mean that if your heart stopped beating on its own, you would pass away naturally. Knowing this information, it is important for you and your physician to discuss your options regarding CPR.